So you can all see my screen, right?
Mm-hmm. Yeah.
Good. Okay, so I'm going to tell you a bit more about the world of orthopedic care. And our purpose is to bring it right in the backyard of those who need it most. And we do that by the professionalization and the decentralization of care in upcoming economies in secondary cities. And we're starting this in Colombia. Did you know that 80% of people with a disability, which is over 40 million people worldwide, have little to no access to orthopedic care? When I say orthopedic care, I mean all sorts of external orthopedic devices. So you can think of prosthetics, crutches, and wheelchairs. So my organization, Care Within Reach, steps in to solve this problem, and we are starting in Colombia. First, a little bit about myself. So since this is an Initiative of Change meeting, I would like to explain a little bit about the link I have with Initiative of Change, and even the link between Initiative of Change and the work that I'm currently doing. Because I actually studied international relations. Also, I studied in the beautiful country of Antoine, France, sciences politiques, political science, and I was always heading towards a diplomatic career. But then in 2013, I think, so about 10 years ago, I went to the conference of Initiative of Change in Switzerland. And there I met an inspiring businessman from Colombia who put me in contact with a Dutch entrepreneur who was working in the field of orthopedics and especially focusing on upcoming economies. And he sparked that curiosity within me to understand a bit better how does this work worldwide. And since I'm 20 years old, I've been traveling quite some times to Colombia. I've worked with drug-addicted street children and with former war children in the 2004. So I knew there was a need in Colombia. So then these two ideas just got together. I've also worked in Colombia for the Women's World Bank, la Cooperación Mundial de la Mujer, in the city of Medellin in 2006. So I had been there already many times. So I knew there was a need for orthopedic care. And all these things together made that I'm currently running a company in orthopedics. And here on the photo, you see our very first clinic that is based in Tunja. But I will share a little bit more about that later. I'm first going to tell you a bit more about the issues around this sector, because I think when we talk about social economy or social entrepreneurship, it's important to mention that these companies are built to solve societal or environmental issues instead of pushing a product into a market. So we're here to solve issues, and I'm first going to explain you a little bit more about the issues that we face. So what are the issues? First of all, what you see if you go to many countries that with upcoming economies is that you see that orthopedic clinicians know how to make a really good prosthetic, but they have little experience running a business. There's also little incentive to start because they lack expertise in operations. So how do you run a team, how to do HR management, how to fix sales, all the operations, administration. That's not their core business. And most of the time, it's these like little companies led by one person that are really good in making these products, but don't know how to run this business. Also, there's fear to start a business. With my current partner that I work with, he, for instance, he fears a bit certification processes. He fears the legal procedures involved in starting a business. And what you also see is that financial return on investment is little because there's overhead. They have to fix contracts, do a lot of administration, make the products, receive clients, reception, accountability. So these things make that small orthopedic practitioners have issues to start their own clinic, and also because they have a lack of finance. It's quite some money needed to start a business and also to have a good financial reserve to make the business viable. So this is also the case in Colombia. You have really good healthcare in Colombia, and it's even numbers 21 when it comes to overall efficiency, according to the World Health Organization. But what you see is that there's little access to care outside of the main cities. So there is 500,000 people at least that are with a disability that are in need of orthopedic care, and it's growing because of chronic health conditions and aging population. People get older. I think the average age for women here is 80 and men like 78. And there's quite some diabetes. So these reasons, and also, diabetes, of course, leads to amputation. So this is why there's quite some people that are in need of a prosthetic, also because often they decide to amputate to prevent worse medical situations. And then the result is many people in need of orthopedic care. So most of these clients live outside main cities, and this increases cost for them and also travel times. As you can see, these 3 photos below. On the first photo, you see a map with all the places in Colombia where you have orthopedic clinics. You see that there's still a lot of places uncovered. And Colombia is a really, really big country. It's bigger than the size of Spain, Portugal, Germany, France, the Netherlands, Belgium, like basically the whole Western Europe together. It's very big. So to travel from one side to the other, it takes ages. On the second photo, you see a photo that was taken by my colleague Sue, who is also in this meeting here today. I previously worked for a foundation when I researched the orthopedic situation in Colombia. And this photo she took of a very small orthopedic clinic. As you see that, the man knows to make amazing prosthetics, but how to build the clinic was a struggle for him, also because of financial issues. And the third photo, you see a client who lives very far outside of the main city that I met in Apartado. So this system issue impacts the life of, for instance, people like Luis, Beatrice, and Gerardo. So Luis has to travel. He's in a wheelchair and he has to travel every week to Bogota. It takes him 8 hours. Beatrice has a healthcare insurance company, but they don't pay for their travel costs. So she had to beg actually to make these travel costs happen. And finally, Gerardo was waiting for his prosthetic for a year and he couldn't work as a baker. So he had to sell the bakery and open up this little store. So we believe in a world in which each individual can live up to their fullest potential, a world that works for everyone, that doesn't exclude people. And this is how we make that happen. We developed a plug-and-play franchise formula for local clinics. So because of this, we enable orthopedic practitioners to launch their own clinic in a secondary city. And it helps to reduce overhead, it increases return on investment. We have a lot of operations manuals that helps the people working for the clinic to operate it in a successful way. We facilitate the sales, the finance, and certification process. So that's my company makes these services to the little clinics. And then finally, we experiment with 3D technology in Colombia. So the clinics are known under the brand name of Profort, Profesionales Ortopédicos. And we provide services such as crutches, wheelchairs, and customized prosthetics. And the good thing is that you can scale it to other countries as well. What we do is we do market research for the clinics. We help them with the setup of the clinic, so with the infrastructure, the design, certification, legal, finance part. This is the pre-opening services, and then there are ongoing services. So we help with the recruitment of the team, the receptionist, with the software, how to use it, the training of the team, operation manuals, but also online visibility and sales, procurement, and access to 3D printing. The businesses, the little clinics have 3 types of revenue streams. There's private clients. They just pay for the orthopedic devices themselves. Then there are insurance companies. They send us their patients. And then finally, there are other clinics. And they have contracts with the large insurance companies in Colombia. And they send us their clients who are based in our region. It's interesting to tell that in Colombia, over 90% of the people are insured. So that's a big number. And this is also why this business model is, we believe, is viable. So I just explained 45 million Colombians, 95% of people are affiliated to the healthcare insurer. Colombia is ranked 22nd out of the 191 healthcare systems in overall efficiency. So the quality of the care is really good. And then finally, there's also, it's only one of the 2 countries in Latin America that has a training center where people learn how to make really good prosthetics. Here you see the map of Colombia, and the number 1 is where the first orthopedic clinic for Ford in Tunja, the city is called Tunja, is based. It's like a 4-hour drive from Bogota. Here you see the core team. So there's me, there's Carlos, he helps with the sales. Then there is the Paula, she helps us with the architecture of the building. We have an amazing accountant called Jamie, and Lina, she helps us with all the design of the folletas, the brochures. And then we have an amazing advisory board as well that help us with a lot of things. This is the corporate structure. So currently this company is built, it's carried and reached in the Netherlands, and then there's the first clinic in Colombia, and then the dream is to build also another, like a sucursal, it's like a daughter, like an affiliate of my company in Colombia, and then there will be interaction between these 2. Where are we today? So this is a whole story, but what is actually happening? Well, we currently have 1 clinic up and running in Tunja, and we provide the blueprint for other clinics to follow. So we opened last year in March 2021. Because of COVID, I had to assist to the opening and see the fruit of our labor by Zoom. It was a bit of special feeling, but also very good. There was live music. There were people from the municipality, from the governance, the departamento, the province who came by. And even the pastor was there to give his blessings. So just the following products, that's what we sell, just to give you a little idea. So we have prosthetics. Prosthetics replace a limb that you don't have. And we have orthotics. So it's, for instance, when you break your arm, so we use plaster to make the mold, and then we make the prosthesis to reinforce or to correct your body part. Then we also sell bandages, and finally there's mobility products, mobility app products, so wheelchairs, crutches. And so far it has been good, but also there were many obstacles. We opened in March, but in April, May, and June, COVID rose up to over 30,000 cases a day, and we had just opened. So we were certified, we were ready to start. We were certified by the Ministry of Health, and then this happened. Also, there was a national riot. Colombia was many times on BBC, CNN. There were, unfortunately, many people who passed away in these riots, so it was quite a hectic time. And some clients of us said, yeah, I need my prosthetic, but I'm not going to risk my life. I'm not going to go on the streets. I would rather stay home. So that was an issue. Then in July, we could finally start sales. So that actually went very well. We had even profit, which is quite impressive for a starting company. So July until October went very well. And then in November, 2 new issues arose. So for instance, I'm just going to ask Vita maybe to mute. So in November, there were issues with components. The customs in Colombia decided to not release any orthopedic components. And then the big companies, they had, of course, a big storage area, a big stock. But because we're small and we have a client and then buying the component made for that client, because the components can be very expensive, we didn't have a lot of stock. So we actually couldn't really produce during 2 months. And then when finally components were released, our carver broke down. And it's a medical carver and it's very hard to get. So it took us about 1.5 months to make the negotiation with companies, import the product. So we had actually a gap of 3.5 months, 4 months in which we couldn't produce. So we're now at this moment, we're recovering from that. We have a really big, long waiting list. I forgot to tell, but I actually moved to Colombia to live here, to support the clinic. Because of COVID, I couldn't do that before, but right now I'm here. I'm based here and I'm supporting the clinic as much as I can. And it's really nice to see clients getting in there every day. for their products, and it's really, really good. They're happy, they're very satisfied with our service, so that's a great feeling. And until today, we have served 350 clients, and we're still counting. Here you see 3 of our clients. We have made a video with all of them, but I would like to show you for now a little video with Karen. She is 6 years old, and she is a pretty cool girl. It takes 2 minutes, but it also gives you a nice insight on the clinic.
Somos un centro ortopédico con sede en el barrio José de las Flores, ubicado en la zona médica de Tunja. Su comodidad de atención son nuestra prioridad. Es por eso que disponemos de un equipo humano siempre dispuesto a trabajar por y para usted, además de contar con áreas para contribuir a mejorar su rehabilitación física.
Yo me llamo Karen, ya tengo 6 años y desde cuando tenía 2 años andaba patines y ahora que tengo ya los 6, ya estoy en patinaje artístico, aprendí mucho. Desde el año me empezaron me quitaron mi pie, que tenía los dedos en la pierna. También me empezaron a hacer la prótesis y yo caminando mal como si nada hubiera pasado. Cuando yo vengo acá, que me arregla la prótesis y también me da la pierna para que yo pueda caminar bien. Yo, gracias a mi pierna, puedo escalar las montañas, que es lo que me gusta, andar patines en la bicicleta y también puedo hacer ejercicios, puedo caminar, puedo bailar. Muchas gracias al doctor Cleto y al Profort. Profort me parece chévere.
Porque su comodidad de atención son nuestra prioridad, le damos la bienvenida a Ortopédica Prefort. Ortopédica Prefort, calidad de vida a tu alcance.
So with this, I would actually like to, we're almost through the presentation. Just trying to see if I can make this big again. So yeah, so the impact we aim to create, just a little bit about the impacts. We believe that with a couple of clinics that we want to build, we can serve over 40,000 clients. Then per clinic, we can create 6 jobs and also indirect jobs. So in local institutions. So what we do is we go to regions where there is no orthopedic center based. So also local institutions will have to need a person that will be focused on this topic. Well, yeah, for further discussion, my favorite quote is one by Ellen Johnson Sirleaf. She's a former first female president of Liberia. The size of your dreams must always exceed your current capacity to achieve them. If your dreams do not scare you, they are not big enough. So this was my story. I'm very curious to hear more about yours, your dream. Things that you would like to realize in your life. And I'm giving the word back to Antoine.
Well, yes, thank you very much. And very nice that your film could go through very well in my side, and I hope of the others as well. And thank you for your very interesting presentation that really does go a long way into the meaning of the last sentence that you put up. You have dreamt big and you are starting to achieve what you've dreamt of. That's very, very wonderful. So now I'd like to, in fact, open the floor for any questions, clarification questions, or a bit more interrogative questions that you could have before we split into groups as announced. We're now 12, so we could do 3 groups. Yes, Peter, and then Kaz.
Thank you, Merel, for a wonderful presentation. I'm very interested in just the background to the financing of this whole project. where did the original funding come from and how do you sustain it?
Yes, so I have received an investment through an investment company in the Netherlands, and it's like a social investor. So they are very patient with us making return on investment. So that's the good part. And I have also received a small subsidy, but it was actually pretty small, from the Dutch government. And that allowed me to get support, financial support or legal support or marketing support. And this is the financial that I had to build the company. And right now, to sustain it is really through the 3 income streams that I showed. So there's private clients showing up that say, I just want to buy this. Then there's, I don't want to wait anymore for my insurance company because they can be a bit slow in Colombia. Then there's insurance companies. And then the other income stream is through big companies in the capital city. And they send us their clients. Yeah. You're welcome.
Thank you. And Kaze, you were second, and then Daniela.
Hello, everyone. This is Case. I'm in Canada, so it's really early morning for me. So please forgive me for not coming on video. But I found this, initiative very interesting. Thank you, Merel, for sharing it. I come from an industrial design background, so I see the value of what you're really doing in terms of, being able to work on prosthetics. I think I have 2 questions right now. One of them is, how do you manage customization at scale? Because everybody, all of your clients require customized solutions for their specific needs. So how do you manage that at scale? That is my first question. My second question is, you mentioned that there is an aging population which needs a lot of attention and priority. But a lot of this aging population may or may not always be able to visit an institution at a moment's notice, right? So do you have a facility available for home care, which is becoming a big point of view from the healthcare standpoint, at least here in North America? So those are my 2 questions. Thank you.
Thank you for your questions. So to just share the first question is about the scaling. It's true, for every clinic, we need to create a new, we need a new clinic, we need a place to go. So of course, we can guarantee the same medical standards through the operation manuals that are really core. It really guarantees that every client receives the same kind of care, receives the same bienvenido, so the same welcome, and the same treatment. That's one. And second is that we only work with trained people. So as I said, in the whole Latin America, there are only 2 countries that actually provide an ISPO certified education. So it's International Society for Prosthetists and Orthotists, and they have granted 2 schools in South America this title. So this is how we guarantee the same service. But yeah, it's always hard because the clients need to come to the clinic, we need to take the mold, so it's indeed very customized. And what we do sometimes is we go to them, but we cannot always do them because it's very time intensive. And the second question is about home care. I didn't really see. Can you explain again what's the relation with the
Sure. I can give you an example. So I'm living here in Vancouver, BC, and one of my the place I live at, my landlady, she had a mother who was 94, 95 years old, and her mother had a prosthetic ankle. And there was a lot of times where the prosthetic didn't fit properly, or had to be worn in a certain specific manner, and there was a whole process behind doing that. And there was when I lived at the house, I sort of saw her through that process in terms of, you know, how she interacted with that specific device or a tool essentially, right, for her. And I realized that, you know, there was this gap almost in terms of the prosthetic company providing the prosthetic versus, you know, having a process to train the person who was actually using it. So there was a learning curve involved, and there was a lot of discomfort in the process for the person who was actually using it. So, you know, I feel that there needs to be, or might be in the future, some version of what you're saying, but in terms of like more focus to, you know, being able to do that, because not everyone who is 95 years old may or may not be able to get to a clinic or be able to get on Zoom quickly as we do. To be able to.
So you mean that we travel towards the clients, right? That's what you're suggesting. Yeah, of course. We sometimes have to, because sometimes people are in hospital, so we travel to the hospital. But most of the times it's just impossible because it's such a big country, so we cannot go to everybody. We would require. But it is an important thing, the transport. Then
thank you.
Yeah, you're welcome. What I also see sometimes is that to people that are not very mobile, that actually would need a very basic prosthetic, they give them this super fancy, very complex prosthetic because they can make more money on it. So I think what is always important is the need of the client and not the financial needs of the company around it. Yeah.
Okay, so then we have Daniel, who has been waiting, and then Matthias, and then I think we will split into groups after that.
But maybe one more thing about what I just shared, because right now I think the whole idea about the people getting to like the decentralization, the whole aim of this business is to decentralize care. So whereas people used to travel 10 hours, now they travel maybe 1 hour or even less.
Okay.
So yeah, that already helps. But I think to really visit people at home, we require a real big team. Yeah. Okay. Next question.
Thank you. Yeah.
You're welcome. Yeah.
Thank you, and Merel, for a nice presentation. My name is Dan Flynn. I'm born in the U.S., citizen of Ireland and resident of Belgium, just south, and actually Verviers is my domicile, which is south of Maastricht. So I can say dank je wel. And my question, though, is from my life experience. I was born in the United States, which used to have nonprofit medical services and insurance called Blue Cross Blue Shield. But in my lifetime, medical system in the U.S. moved entirely to for-profit. And then my wife and I moved here 21 years ago and discovered a beautiful first-class medical system here in Belgium, which is not for-profit. And of course, my other country of citizenship, Ireland, tends to follow, like Britain, the U.S., partially the U.S. model. There's basic medical coverage for citizens without a fee, but there's also optional medical insurance. And I, in fact, was in one of the ads when the Netherlands went to this optional medical insurance. I think one of your companies, Medev or something like that, I was in their advertisements. My question, and I'm also a volunteer for Doctors Without Borders, who believe that basic free medical service is a human right. So I just wanted to explore with you, where do you stand on the medicine for profit, medicine for as a social responsibility spectrum, and where do you want to steer your company?
Thank you for your question, Daniel. So I fully agree with you. Free medical services should be everywhere, and I wish it was the case. In Colombia, fortunately, the insurance company pays mostly everything. Sometimes clients have to pay like 5%. But what I haven't explained yet, but we reserve 10% of our profits to help clients that cannot access care. So this is how we can make it happen for people who, for instance, do have an insurance company but cannot pay the 5%, or they do have an insurance company but cannot pay for the travel costs. So this is how we help. And one of the other plans is to help people understand their rights, because sometimes people, they don't know how to get access to a prosthetic. They know they need it, but the insurance company doesn't call back, or they don't write back, and then they feel stuck and they don't know what to do. So also to give that legal support to them. That would be also one of the dreams to accomplish.
And finally, Matthias.
Yeah, Matthias from Berlin. I'm running myself also a social company for preschooling, One World Kinder, as we are called. I mean, you, Merel, you are at the start of something big, which is great. And my question is, since you're at the moment, I think I would suppose, yeah, a close knit family type of group of people. But have you already thought of outline of culture, of company culture regarding the communication, participation, and welcoming new employees, which I think it's important if you are aiming to enlarge on a bigger scale. So have you already thought of such a culture you want to establish?
Yeah, thank you for your question. Vielen Dank, Matthias. I have thought about that. We have created some sort of introduction manual for everyone that's new to the company. We explain our core values that are very important to us, which is inclusion, transparency, treating every patient in the same way with respect. So every new employee, actually, we just have a new receptionist for 2 weeks now. That goes through that process of the company values and company culture. Yeah, very important. And I also really believe in doing outings together and make sure that the team is very connected. And this is actually the case right now. So I'm grateful for that.
Super, thank you, Paul, for your questions that allowed Merel to give us even more interesting details. So now we're going to split as announced in